Hello and welcome. My name is Megan Huth, and I am a research assistant at Benjamin Rose Institute on Aging. Thank you for joining us today for a conversation on the results and implications of the 2024 presidential election, presented in partnership with the Elder Justice Coalition. This webinar will be recorded. You may submit a question at any time using the Q&A or chat feature on the bottom of your screen. We have staff monitoring to convey your questions to our presenters and to answer any technical questions you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of the screen. Today, we have the pleasure of hearing from Mr. Robert Bob Blancato, president of the Matz, Blancato and Associates, and national coordinator of the bipartisan 3,000-member Elder Justice Coalition. He is also the executive director of the National Association of Nutrition and Aging Services Programs and the national coordinator of the Defeat Malnutrition. Mr. Blancato has been long recognized as a national advocate with policy expertise on behalf of older adults. He has testified numerous times before House and Senate committees, and his prior work history includes 17 years as a staffer in Congress and an appointment by President Clinton to be the executive director of the 1995 White House Conference on Aging, one of four he has participated in. He is a member of the Senior Executive Service. As a volunteer, Mr. Blancato currently serves as second vice chair of the AARP board and is also on the AARP Foundation and the board of the National Hispanic Council on Aging. From 2019 to 2023, Mr. Blancato served on the National Advisory Committee on Rural Health and Human Services. And with that, Bob, you can take it away.
Megan, thank you very much for the nice introduction, and I want to thank Benjamin Rose for hosting today's webinar in conjunction with our Elder Justice Coalition. Let me thank in advance Zoe for moving the slides and Michelle for helping with other technical issues that come up. And I guess to some degree, my title may be a misnomer to some extent because the dust has not settled. We're just going to say it's moving along. And let's go to the first slide. And also, let me take a moment to salute my friend Orion Bell, the leader of the Benjamin Rose Institute on Aging, my colleague and friend, and hopefully he'll join us with some comments at some point. So let's begin with lessons from the election. First thing is, don't go into the polling business. Think about that. They did the impossible. They made weathermen look accurate. But do believe in the power of messages. History has shown us the candidate with the better message wins, or the message that gets most attention. So George Bush the first, read my lips, no new taxes. Bill Clinton, it's the economy, stupid. Barack Obama, hope and change. And Trump 1 and 2, make America great again. Next slide. So we know that this election was historic in many ways. The votes were cast. See if we can get to the next slide here. But 158 million ballots were cast, and 52% of them were older voters. Second highest voter turnout in 50 years, and we know this campaign was a lot of issues, a lot of things that went into this campaign, from the fact of having the Vice President Harris having 107 days to put a campaign together, a lot of issues, a lot of podcasts, a lot of this and that. So we're not going to go through all that. We're going to talk about what could be next and what might be on the aging policy agenda. Next slide. So before we get to next year, we got to get finished with this year. And right now we are in the middle of a lame duck session of Congress. Lame duck means that 53 members of the current Congress are not returning in 2025, 8 from the Senate and 45 from the House. So the question is, what's going to come out of the law of this lame duck session? We began the session thinking that the bill that was going to pass first was an emergency spending bill for disasters. And think about this one fact. We have had over 100 major disasters declared by the Federal Emergency Management Agency just in 2024. The Biden administration did send a proposal to Congress seeking $100 billion in disaster relief. There is an outside chance that funding for Older Americans Act nutrition program could be in that package. However, next slide, when you do these kind of presentations, if you write a slide on a Monday, it could be obsolete by Tuesday, the way things are happening in this town. So the disaster thing is now moving to another place. We have a deadline of next Thursday, next Friday, by which Congress must pass a bill to keep the government open and keep programs and services funded. So the question is, what is Congress going to do about that, about disasters? And we now know that it's a little clearer, okay? There's more and more talk about taking that December 20th deadline and moving it into sometime in March to keep the government open and keep funding coming. But the bill may now include not just continuation of funding, but disaster aid and some health provisions, okay? And we'll go to the next slide and talk about what could be in those health provisions. And it looks like it will be attached to this funding bill. There's proposals that have been out there to extend telehealth. And now on both sides, they're talking about extending telehealth on the far end for 3 years, on the short end for 6 months. Preventing a physician pay reduction under Medicare is being talked about as well. In addition, reforming pharmacy benefit managers and the way they do work, which has gotten a lot of attention. Something new that I've learned this morning that wasn't on this slide is possible additional funding for federally qualified health centers, and perhaps averting or postponing a cut in Medicaid for safety net hospitals. Okay, these are all things that could be attached to a funding bill, a health bill. However, as is the case, you have to find ways to pay for all these things that you are extending or modifying or whatever. And right now, the big controversy is, will one of the pay-fors, the major pay-for, actually be a decision to repeal the minimum nursing home staffing rules that were produced by the Biden administration several months ago? The estimates are, if you repeal it completely, that gives you $22 billion in a pay-for that could pay for a number of things that are able to happen. And I'm going to point out that we're going to be covering a lot of topics today, and I think we agreed earlier that we're going to let you chat away and question away, and we're going to pause if there's enough questions that come in based on a topic that came up. So feel free to do that as you see something come up that you're interested in. Let's go to the next slide. And this is, again, a very current situation. The dynamics have changed even today. So we are hoping, strongly hoping, that Congress will complete action on a reauthorization of the Older Americans Act. When the Senate came back in early December, they announced they were going to put the Older Americans Act on what they call a hotline, which allows a bill to be taken up under much faster processes. You put a hotline out there and you wait for see if any senator, Republican or Democrat, objects to it. If there's nothing that comes back in the way of opposition, then they take the bill and pass it by what they call unanimous consent, okay, with not a formal vote, just unanimous consent. Now, the bill they talked about being able to come up in December was negotiated with the House, who would then take it up after the Senate acts. Okay, it's not a slam dunk yet. However, we did learn this morning that there is a chance that by day's end, the Senate may, in fact, do their part and pass this Older Americans Act reauthorization. And let me tell you why it's important in our mind to get it done this year as compared to next year. First of all, the way Congress operates, the way sessions of Congress operate, if you don't have your bill completed by the end of a session of Congress, then you have to start all over again from scratch, okay? And a lot of work has gone into this Older Americans Act up to this point. And the idea of having to go to starting all over again from scratch concerns a number of people. Secondly, some of you have heard about whether you call it DOGE or DOGE Commission, I don't know how you pronounce it myself, but they are going to be looking to target programs that have not been authorized as a means of reducing federal expenditures. So those two good reasons exist for why we are hoping that by today's end, at least the Senate will have completed action and passed the Older Americans Act reauthorization. Next slide. So let me tell you just quickly some of the things that are contained in this bill. One, the bill itself is an outgrowth of a bill that was produced earlier this year, a bipartisan bill crafted by 8 senators. It's a 4-year renewal of the Older Americans Act with an 18% increase in funding over its 4 years. It would call for a White House conference on aging to be held next year. It would have a new direct care workforce resource center. And we all know how the importance of the workforce at this point in time. It would enhance flexibilities that were established during the pandemic, particularly in the nutrition program, where you could do things like grab and go for meals or have restaurant partnerships or all kinds of new ways to do what the program used to do before the pandemic. Because many of you realize, who are aging network folks, that the nutrition program stood on its head in the pandemic. Okay? Before the pandemic, 2/3 of older Americans were served in the nutrition program were served in congregate settings. Within weeks after the pandemic hit, 95% or more were getting their meals at home. And that forced the network to come up with new ideas to still keep the program going. And some of these flexibilities will be continued in the new Older Americans Act. And finally, area agencies on aging have done a wonderful job developing relationships with the private sector to enhance their ability to provide services and programs and so on. This bill would clarify that if you are not using Older Americans Act funding, you don't have too many constraints in terms of being able to contract as an area agency on aging, meaning you don't have to have state approval for everything that you seek to contract for. So those are the main provisions of this particular Older Americans Act. And I think I'll stop here. Megan, do we have anything that we want to chat about right yet, or questions?
I don't see any questions yet, Bob, but I'm sure they'll be coming in shortly.
Okay, very good. So let's go to the next slide and think about how it's going to be 2025 before we know it. And what's going to happen between now and President Trump swearing in on January 20th? Well, I'll give you a little insight, local insight, since I'm in DC. I was walking to an event last night, and already on Pennsylvania Avenue in front of the White House, all the construction for the inauguration has begun. So we know that that's the first sign that we're getting closer to January 20th. And, for folks who are following this whole process, this is not year one for Donald Trump. This is year 5. Okay. This is not Trump 2. This is Trump 2.0. Okay. And we're already having to learn new acronyms. Like we knew about MAGA, Make America Great Again, but now we have MAHA, Make America Healthy Again. And then, of course, the DOGE, the Government Efficiency Commission. So these two individuals are the leading spokespeople, if you will, for these acronyms. Next slide. Now, you can tell it's 2.0 because the pace of nominations that the president has come forward with has been astounding by most people's view. First of all, he began by naming the first ever woman chief of staff, Susie Wild, the first woman to hold the job of chief of staff in the history of our country. And then, among the more interesting and somewhat controversial appointments so far, nominations, I should say, so far, Secretary of Health and Human Services, Robert Kennedy Jr., the head of the Centers for Medicare and Medicaid Services, Dr. Oz, the head of the Centers for Disease Control, former Congressman Dave Weldon from Florida, the head of the National Institute on Aging, the health economist, Dr. Jay Bhattacharya, and then for Attorney General, the former Florida Attorney General, Pam Bondi. So far, and maybe this number has gone up today, I don't know, but he's nominated 28 people who worked in his first administration to positions in his new administration. And all the ones I have above there, except Susie Wild, have to be confirmed by the Senate. And the question is, will they all be confirmed? And I don't think so. And I think some may not even get to having a hearing for confirmation. So next slide. This goes now to discussing what happened with the Congress. Okay. And you know the term trifecta from another vantage point, I suspect, but trifecta in our town means that one party has control of all three entities, the White House, the Senate, and the House. And that will be the case in the 119th Congress, which begins in January. The Senate majority of 53 to 47 is the largest margin either party has had since 2019. By contrast, the House of Representatives margin of 220 to 215 is the smallest since 1933. And you can put an asterisk next to that because the president-elect has already named 2 House members to positions in his new administration, which will bring that margin down to just about almost even. And so when you talk about the importance of a flip of the Senate, for example, and that margin of 53-47, why is that so important? Well, one reason for sure, they have the responsibility of confirming nominations for the cabinet and sub-cabinet. And this allows them to return to a process called reconciliation, which I'm happy to explain in my next slide. Reconciliation is a process by which the major bills only need to pass with a simple majority in the Senate that's 51 votes versus 60 votes. Now, if you have a 53-47 margin, that gives you a little cushion, obviously. But already in this era of bringing back reconciliation, we find division between the House and the Senate on when to do it and how to do it. The Senate, for example, thinks that we should do an energy border security bill first, then do a tax bill. The House says, no, let's do a tax bill first. Now, yesterday, at least one of those bodies said, let's have the president-elect decide what we should do, and we're waiting to see what his preference would be. Next slide. So let's talk about how the Senate changed and what it means. Starting with the top position in the Senate, the majority leader of the Senate. Senator John Thune from South Dakota, who's been in there for some 18 years. He has long known and been understood as an institutionalist, someone who understands the workings of the Senate. And the part that's most important is that he will allow the Senate to maintain its important role as a check on both the executive branch and the judicial branch, because we have a system of checks and balances in our country, and there are times when it becomes very important that all entities know that. Now, we talk about committees, okay? For those who cover funding issues, Senator Susan Collins of Maine will become the new chair of the Appropriations Committee. Susan Collins has a long history of being involved in work around aging. She should chair the Senate Special Committee on Aging. She comes from the second oldest state in the country of Maine, and she is very familiar with that role. The chair of the Senate Health, Education, Labor, and Pensions Committee will be Senator Bill Cassidy of Louisiana, a physician. That committee covers the Older Americans Act, prescription drugs, workforce issues, and holds one of the two confirmation hearings for the new Secretary of HHS. Now, showing also contrasts, Senator Cassidy replaces Senator Bernie Sanders, who is the current chair of that committee. And you know that's somewhat of an ideological difference. Now you move to the Finance Committee. Senator Mike Crapo of Idaho will be the new chair. And that committee has a huge amount of responsibilities. They cover Medicare, Social Security, taxes, elder justice. The Treasury Secretary has to be confirmed. And this committee votes to confirm the HHS Secretary and the CMS Administrator. So they have quite the full plate. And then we have the new Judiciary Chair, Senator Grassley of Iowa, which will cover the Attorney General confirmation and a number of other issues. Not on this slide, but we learned that Senator Rick Scott of Florida will become the new chairman of the Senate Special Committee on Aging. And as you all know, you have a new senator, Bernie Moreno, who replaced Senator Brown as the first Latino to represent Ohio in the Senate. Next slide.
Bob, we have a couple questions come in. Would you like to answer some now, or
I would love to, sure.
Okay. So we'll start off with the first one we received. How do we prevent negating the nursing home staffing, which is still low legislation after all the work is done?
Well, that's a good question, and it's going to come down to, again, going back to my earlier point, this was proposed as a rule, okay, as compared to a piece of legislation. So when rules are put forward by an administration, if a new administration comes in, they have the ability to rescind, repeal, change, modify a rule. If this large spending bill that I talked about earlier, comes to fruition at the size they're talking about, then they will ask for that rule to be repealed or rescinded to pick up savings. So the way to stop that is to urge opposition to the spending package. But my gut tells me that when you reach the point where it's December 20th and a session of Congress is about to end and the holidays are about to begin, the chances of defeating a bill like a big spending bill are pretty slim. So what you have to do is come back in a new session of Congress and convince members of Congress to introduce this as a piece of legislation and have it be the subject of legislation hearings and so on. So we don't know the final outcome yet of what's going to happen with the spending package, but most people believe that they will tap into this nursing home rule. Now, there is another option of delaying it, okay, which would pick up some other savings. Let's just say, since we are the national coordinator of the Elder Justice Coalition, we're monitoring this thing very carefully, very closely. We're hoping that we can find some other pay for, so it doesn't all have to come on the back of the nursing home staffing rule. But there's enough people in Congress on both sides who care about this issue. And should they do that this year, they'll come back next year and find a way to get some staffing improvements made in nursing homes.
Great.
Thank you for the question.
We have another one that came in. Do you believe that the next administration will move forward with the White House Conference on Aging?
That question comes to me almost every day. And I'm not surprised because it's a subject of great interest to people. Let's take it from the standpoint of structure. If the Older Americans Act does pass this year, this week, actually, if you think about it, or next week, it does contain language authorizing a 2025 White House Conference on Aging, which is a huge step toward actually having it happen. However, it is also incumbent upon the president to call a White House Conference on Aging. It just doesn't happen because it's in a bill. The minute the president actually has to call a conference. So, for example, in 1991, Congress authorized a White House Conference on Aging and actually put money into it. But President Bush the first chose not to call the White House Conference, and it was not held in 1991. It was resumed in 1995, which was the one I had the pleasure of working on. So if we close this year out with the Older Americans Act having been done on a bipartisan basis with the White House Conference in there, I think that's a positive sign that would indicate it would go forward. However, the president does have a say in a White House Conference on Aging. And to my knowledge, there's been no commentary made by the president-elect about where he would be on a White House conference, but I assume it will come up as a topic early next year. Sorry for all the noise outside. I hope it's not coming through here. But.
Oh, it's not. Orion,
Okay, good.
that you turned your camera on. Did you have any comments?
No, just in thinking about the nursing home one, there's some headwinds on that one too from some of the folks that were opposed to it, including folks like Leading Age and others that are often on the same side of those conversations as the Aging Network, but not always.
That's very true.
I think it's a tough sell, I think, because there are at some levels some legitimate concerns about the ability to operate under the guidance without the staff that they need. So I think it'll be interesting to see how that conversation plays out in other discussions around workforce and staffing and even immigration.
Right. That's true. That last point is very true. And if we did nothing else next year, if we could convert the discussion on workforce into a discussion on how immigration could help address workforce, that would be a big step forward and not demonize the issue as it has been for a long period of time. Orion, any thought on the White House conference while we have you on the camera there?
Well, I think the last one was a Trump White House event, wasn't it? Didn't we have one when
we had one? No, the last one was in 2015 under President Obama.
It was earlier than that. I was
right,
thinking one when Lance Robertson
right.
was
and the previous one was under Bush 2, and then Clinton did 95, Reagan did 81, Nixon did 71, and Eisenhower and Kennedy sort of combined efforts for the first one in 1961. So there have been bipartisan White House conferences, and hopefully if it stays in the bill, we'll be in good shape. I see a question that just came in. Can I provide an insight into the role that Russ Voigt may play as the Director of Office of Management and Budget, as he's been nominated by President Trump? Well, he is going to be a tough steward of the federal dollar. He has been actively involved in the Project 2025 work. He has a prior history of seeking to reduce, federal spending and so on. It will make for an interesting first budget proposal from the President Trump when he gets into office. People are going to have to justify spending in ways that maybe they haven't had to do before. Part of the message that we try to convey in our work is to show that a number of the aging programs that we're all familiar with, if looked upon in all honesty, represent preventative, they're cost investments, if you will. But he's going to be tough. I mean, there's no way around it. He's going to be tough. He aspired to this job. The president-elect has granted it to him, and we just have to be ready. And I know folks will be come January. Any other one, Megan?
So we have 3 more in Q&A, one that was in chat. Do you want to keep going, or do you?
Yeah, sure. Let's do it. We're good.
Sure. So we have another one. Bob, what are your thoughts on his possible appointment to lead ACL? How safe are current staff, with the exception of the 2 staff positions who are appointed and will step off?
Well, that's another good question, because this whole Dougie or Dogged, whatever it is called, is seeking to retransform the workforce, the federal workforce. How deep and how far they can go remains to be seen. How much they can do without congressional approval remains to be seen. There is a Civil Service Act that has to be somehow addressed in terms of rights that federal employees have or career people. As far as candidates for the position, I think it's premature to know that yet, because it isn't so much who the president chooses, but the president wants to do it in consultation with his Secretary of Health and Human Services when that person is confirmed. And to some degree, they want to have some consultation with the new head of Centers for Medicare and Medicaid Services, since ACL and CMS do work well together. I know there'll be a number of people who will be considered, but it's a little too early to dive into that speculation pot. But we'll be keeping our eye on it for sure.
I know somebody wrote in chat, can you repeat that? Rick Scott now chairs Senate Committee on Aging, if you have any comments on that.
First of all, it's when you aspire to become chair of a committee, it's usually through a seniority system. So probably on the basis of where he was in the seniority ranks of the committee allows him to become the chair. He is from Florida, which, as you know, is an intensely big state in the aging space. But he also has some ideas that over the course of time have, caused some people some angst. But the Special Committee on Aging, is not a legislative committee. Let's start with that. The committee does not produce any bills. It has the responsibility of doing oversight, doing hearings, doing investigations, and then sometimes their work gets sent to committees that do have legislative responsibility, and it influences what they might do. But traditionally, up until even right now, this committee has operated in a bipartisan way. Outgoing Chairman Bob Casey from Pennsylvania worked very closely with Senator Braun, who Orion knows well from his days in Indiana. And as I mentioned earlier, the Older Americans Act that's currently before the Senate and the House was produced by 8 senators on a bipartisan basis. 2 of them were the top people in the Aging Committee. So until proven otherwise, we'll assume the history will prevail and this committee will continue that way. But we will all have to keep an eye on things as they unfold.
Thank you. Yeah, 3 more Q&A.
Sure.
What methods could the new administration use to try and repeal or revoke or otherwise stop the new Older Americans Act regulations from taking effect?
That's a good question. They're all good questions. Sounds like you folks have been from Washington or something, But, it would be surprising, first of all, if they did that. Okay. But they can do any number of things executive order wise, that could be, that's why you have to watch what happens with the nursing home rule, even though Congress will be the one making that decision on the front end. Every incoming administration has the ability to do anything they want with previous rules and regulations that are produced by a prior administration. To my knowledge, and I've been through the whole process with these regs for a long time. First of all, you got to realize that the first regulations to be produced for the Older Americans Act since 1988. Okay, and a lot of time has passed since 1988. The product that the administration produced for these regulations did not generate a whole lot of controversy, unlike the nursing home staffing rules have. And so because it hasn't really reached that level of controversy, it would be surprising to me for them to take that on as a target. If anything, the responsibility between now and January 20th, and I had a conversation yesterday with the acting ACL administrator about this very point. The idea is to get all the guidance out into the street that you need to have to understand how these regs will work, how they can work for you, and that's what they're going to do. And I think that will help them I think they're going to be retained. Oh boy, I see people I know sending questions, and that's dangerous. Okay, but let's keep going, Megan. We're doing all right here.
All right. Okay. So next one that came up.
Or you got any comment, Orion? Chop in, whatever.
No, I think you're spot on about the OAA stuff. I think it's probably not. It's not in the crosshairs. Some other things are. So I think it may slide through.
All right, Megan, go ahead. Whatever's next.
What do you anticipate will happen with the Consumer Financial Protection Bureau?
Now, there's a target. That was a target in the first go around in this administration. I think, the Supreme Court, as I recall, upheld their authority to exist, which I think has a bearing looking ahead. I think probably they'll be looked at. They may get scaled back. Do they get eliminated? No, I don't think they'll go that far, because there are some pretty strong consumer advocates in the Senate in particular who would probably push back strongly on that. And the other fact of it is, on a bipartisan basis, what they're doing to help educate people, raise awareness about issues around fraud and things of that nature are more critical now than ever before. So I think they have their champions in the Congress, and many of them are still here. So I think there'll be a target, but I don't know if if it'll be like the end of them. I don't think it's going to happen that way.
Next question. Do you see this new administration having any effect on the new APS final federal rule?
Same thing, yeah. Again, because now there a little more controversy with the APS rules because of the issue of the funding to go along with making sure these rules can be implemented. Now, this brings up the topic that Ori and I talk about a lot, and we all do in the Elder Justice a lot. We have too little funding for elder justice programs, and particularly for adult protective services. One has to remember that during the pandemic, Congress saw fit to give the Elder Justice Act unprecedented amount of money, $376 million in a 4-month period, after getting only about $120 million over the first 10 years of that act. 95% of that money went to adult protective services, in part to address the issue of scams that were proliferating during the pandemic, issues about what was going to happen after the pandemic, about getting more reports about elder abuse, which we know would and has happened. So if there's going to be a controversy around the APS rules, it's going to be about, what's put in them and how you implement them without proper resources. The strategy from our side is you work the funding side more aggressively than anything else, so that you don't have that argument to raise when it comes to the APS regs. But at the moment, if you use current funding levels, all APS has in formula grants is $15 million. And we know that's not enough. Now, there is an outside chance, and I'll give Congressman Richard Neal from Massachusetts a champion of elder justice. He is trying to get $188 million for APS into this final bill that I talked about earlier, this final spending bill. And we're working hard with him to try to do that. And there's a chance that could happen, in which case that would probably obviate some of the concerns about the regs. But they were more controversial than the Older Americans Act regs were, but are they controversial enough to be repealed? I don't think so.
Thank you. The next question in Q&A. Dr. Oz has previously promoted a Medicare for all health insurance program for everyone not on Medicaid, eliminating employee health options. This will completely privatize healthcare in this country. Trump is in favor of privatizing healthcare. Do you see this as a real possibility? And how difficult will it be to create a Medicare for all?
Well, if I understood his position, he's for Medicare Advantage for all, as compared to Medicare for all, which is a little different. Medicare Advantage is the emerging flip side of Medicare, if you will, which offers a whole range of supplemental benefits to the individuals who enroll, things like nutrition and transportation and things of that nature. But it's gained a lot in popularity. Now more than half of Medicare enrollees are in Medicare Advantage. However, as also is known, there are a lot of issues about Medicare Advantage and prior authorization for approval for treatment and honoring claims and things of that nature and marketing. So what Dr. Oz's potential is that he could come in and try to lessen some of the burdens on Medicare Advantage and let more people into it. But I don't think you're going to reach a point where it's going to be Medicare Advantage for all. If anything, what could happen, even if Dr. Oz doesn't promote it, is that as long as these supplemental benefits continue to be as popular as they seem to be, it may be that fee-for-service Medicare decides to go the same way and adopt some of those same opportunities. But you got to remember that these supplemental benefits have caused some angst among the providers because they're being utilized a lot, which was the hope that they would be, but they find that to be a problem on their bottom line. So there will be fascinating hearings when Dr. Oz comes before the Senate Finance Committee to talk about his vision for CMS. And privatizing, sure. I mean, I think there'll be efforts to do a lot of privatizing in a lot of arenas in this administration, but I don't think we're going to see a Medicare Advantage for all come out of this administration. Orion, you got a thought on that one?
Well, it's interesting. I agree with you, Bob. I think it'll take some twist, and some of us got to sit in on a session that Brian Lundberg did at the GSA meetings last month, and had staffers from Democratic and Republican leadership talking about some things, and they talked about Medicare. And there was a lot of amongst the budget hawks, there was a lot of concern about describing Medicare Advantage as being somewhat of a black box, that we don't know where the money goes. It has overtaken Medicare in terms of the numbers of people in it. Some of the scrutiny around the pharmacy benefit management programs is bipartisan, and that's contained in some of those discussions. You mentioned the prior authorization piece of it. Health systems that have pulled out of participation in Medicare Advantage plans, and some fairly large and high profile hospital systems that have done that. So I think there's probably as much there's probably as much attention on the effectiveness of it or the cost of it from that wing of the Republican Party as there is focus on it from the consumer perspective from the Democratic side, which means that they all end up asking the same questions. So I think there's some potential that there'll be some performance pressure on the Medicare Advantage programs at the outset, because both consumer interest and budget deficit hawks are interested in knowing where the money is.
Right, exactly. I think let's go to the next slide, because everybody's memorized this one for sure. It's been up so long, they probably have it all committed to memory. So let me flip to this and open up a couple other topic areas that we could get to. In my judgment, what could be on the aging agenda? Okay, a family caregiver tax credit, which I'll talk about a little bit later. Medicaid reform, which I'll talk about in a later slide. Medicare reforms around prescription drugs and doctors' pay and telehealth extension. Now, the Older Americans Act and Elder Justice have a star next to them, because if they pass in this year, the Older Americans Act in particular, then you're talking about a different approach versus the implementation versus actually having to produce a bill. Elder Justice Act's not going to pass this year, so we have to start that over again next year. Long-term care is emerging back as a topic, which I'm glad to see because we spent too many years denying that we need to deal with long-term care. And then Social Security should stay quiet, although the president-elect did offer a proposal to end the taxation of Social Security benefits, which, time will tell whether that actually holds up or not. Let's go to the next slide. I want to give the benefit of a little bit of punditry on my part, if you will. So if you look at what the National Journal said were the priorities for this new administration coming in: tax cuts, immigration focused on the border, energy and climate, more drilling, less regulations, slowing down our commitment to Ukraine, and imposition of tariffs. Okay. What are the train wrecks, according to me, that could come up next year? The debt ceiling is one of the first because we smack up against it early in the year, and there's a point by which it has to be lifted, or we go into default as a nation, which nobody wants to see. How big will that tax cut be, and what are the offsets going to be to pay for it? What will be the impact of imposing those tariffs on prices in the United States at a time when President-elect Trump won the election in part because of his commitment to lowering inflation and lowering costs? What will be the final funding bill for fiscal year 25, since it does go till September 30th? And finally, what kind of drama, theater, comedy, whatever is going to be going on during our confirmation hearings for all these people that I mentioned earlier? Let's go to the next slide, because I do want to spend a little time on the issue of the family caregiver tax credit, because I think this is a sleeper issue that on the plus side, it was proposed by the President-elect Trump, as also Vice President Harris had called for a new home care benefit under Medicare. But we're not talking about a freestanding family caregiver tax credit. Okay, we're talking about putting it as part of a larger tax bill. The positive side of this conversation is how important and how powerful caregiving as an issue and caregivers as a political force have become. Okay, something we've all been hoping for a number of elections, and I think this one proved that it had risen to that level. And we know a broad tax bill is going to be one of the first bills taken up in 2025. The House would have it be the first bill if they could. So the issue is going to be for all of us: how big is the bill going to be, and what will be those paid fors to pay for this bill? And are they going to come from aging programs? And if we're looking at a bill that has a bunch of cuts for aging programs, but it has a family caregiver tax credit, are you going to recommend that your House or Senate member vote for it? That's going to be a question that we're all going to have to confront sooner or later. Megan, let's go back to you now before we go into any other topic here.
Sure. I think everybody's enjoying all the engagement from chat and Q&A. I just want to remind everyone that just if we don't get to it today, we're going to be emailing all of your questions to Bob and Orion to answer them. So, even if we don't have enough time to get to you, your questions will be answered. So keep them coming.
And the slides will be available too. So
yes,
right.
and the webinar. So we'll jump to Barbara Sullivan, who asked a question in chat. Do you foresee a select committee on aging in 2025 in the House?
Well, as the woman who runs the Village to Village Network, good to hear you raise the question, Barbara. If I had seen more Republican support for the resolution that's currently in the House to recreate the House Committee on Aging, I'd feel more optimistic. The fact that a resolution had been introduced in a number of Democratic-run House of Representatives and couldn't get done did cause me some concern. I don't know whether the sentiment or the impetus will come from the Republican side or not. My suggestion would be that people should approach it the same way they did this year, which is to push for it. Because, as a longer-serving staff member of the House Select Committee on Aging, I think it was a huge mistake when they eliminated it, because it took away a huge platform for aging issues to be discussed, to be looked at. I mean, we wouldn't have an end of mandatory retirement without the House Select Committee on Aging stepping in and making that their top issue. A lot of other reforms never would have happened. So I think the first thing we have to do in this situation is get a champion to introduce a resolution in the House as quickly as possible, and then put all the advocates to work to make sure it's bipartisan. And then let's see, it's possible. But it's going to take grassroots activity to get it done this time around.
I'm going to jump back to chat for a second. Nicole asked, can you provide any insight into the role that Russ Vought will play in aging and older adult issues?
Yeah, I think we dealt with that one before.
Okay.
Ross Voigt's going to be the new head of the Office of Management and Budget, and I said he'll be a tough cookie. People are going to have to go in and make the best case possible for maintaining funding. And he's had a role in the development of that Project 2025, which has a range of ideas, if you will, that concern some people. But he's a player. There's no question he's a player, and he's got to be respected for that. And people have to work, with him as much as they can.
Thank you. Okay, back to Q&A. Do you anticipate SC, SEP, Title V of OAA being on the chopping block again?
I fear about that. I do have a fear about that, actually. Which is why a reauthorization in 2024 is a safer route to go than wait until 2025. The CSEP program is the only federal program we have for older workers in this country. It has done remarkably good work for those people who have been able to get employed by the program, 70,000 some odd low-income older adults. But, it's what happens in any transition to private sector employment, or what happens when these positions, run out or whatever it may be, that causes the opponents to look at it as a program that we should modify or change. I'm of the view that, I remember in 1981, this shows you, I'm showing my age at this point, when President Reagan came into office, and in his budget, put no money in for CSEP at all back then. And we mounted on the House Select Committee on Aging, another example of its work, the Pink Slip campaign, where we got as many older workers who were employed by CSEP to sign a petition on pink paper saying, please save my job. And we had this press conference with like 20,000 stacks of pink slips. And Congress voted to override the president's veto of a bill that put money back into CSEP. Okay, now that was 1981. Has CSEP passed the point where it's under scrutiny and under challenge? No. But I think knowing that it could be a target is where advocacy comes into play, because you want to drill down in the advocacy to the actual older worker who is benefiting from CSEP, from the community that's benefiting from that older worker working in that place, whether it's a hospital, a library, a senior center, whatever it may be. So the question is a valid question, and it's one that we should be anticipating problems, but I should have a strategy lined up to make sure that CSEP is able to survive, but do it in a way that shows its value. Because value is going to be very important to these folks in this new administration, the value of a program. And I think CSEP can show the value, but it's got to be shown from the people who are most impacted by it.
I'm going to jump back to chat here. Jane asked, Bob, you're thinking on hospital at home waiver extension?
That could end up in the final bill. There's a lot of support for that. In fact, I think the Senate Majority Leader is someone who actually believes in that program as well. Right now it's fast and furious. As we're sitting here on this webinar, there are conversations going on in the House and the Senate about what's going to make it into this bill and what's not going to make it into this bill. Hospital home has been something that's been discussed more positively than a lot of other topics I've heard about, but it's going to take a push. The champions that you can turn to, who are the champions of this, need to be heard. You need to talk to them now to urge them to keep the pressure on to get that contained in the final bill. You're at that really critical juncture right now. And Jane, I know your role in this, and I know the leadership of the Hartford Foundation in this space. And I hope that we can all work together to keep that in the final bill. I'm sure Orion has a comment on that one too.
Yeah, I think there's a lot of advocacy for it from different perspectives. We just have to make sure that stays top of mind, because it's not controversial or exciting.
Right.
So it's good policy, it's good practice, but that doesn't necessarily mean that people are thinking about it. Sometimes if it's working, we'll notice it. So we have to remind people about the importance of it. And it's another great place where that connection to the caregiver issues is so important, because you can't do hospital at home if you don't have good informal supports in place for people in the community. So yeah, I think it's well liked, but it needs some pizzazz sometimes to get it some of the attention that we.
Or as you sometimes say, you need to make it more sexy, so it jumps out and people are happy. So for those people who think Bob Blancato didn't prepare for this webinar, I think I'm going to go back to my slides to show that we did have a few more things to share with the audience, and then we'll come back to the. So Medicaid reform, count on it. Count on it. Count on it. Take it to the bank. It's going to happen. The question is, what kind of Medicaid reform are we talking about? I don't think block grants are going to be where we go, but certainly capping the federal share of Medicaid to those states that expanded it under the ACA. Work requirements are going to be tried and tried and tried and tried. And some more limits on home and community-based service. I can't describe what that is, but we're looking at some movement in that direction. Next slide on Medicare. Everybody said in the campaign, we're going to protect Medicare. Okay, but there'll be some changes. One thing I can say clearly, that the Inflation Reduction Act is not going to get repealed. But the administration may tinker with things like, what are the drugs that will be negotiated under Medicare for price? Okay. But the reason why it's not going to get repealed is this is the year that the $2,000 out-of-pocket cap on Part D drug expenses kicks in. And Republicans and Democrats, every aging advocacy group I know, everybody worked to get this into the bill. And also, people should know this if they don't already. There's a provision called smoothing, which means you don't have to pay the whole $2,000 at one time. You can spread it out over the course of a year, which makes it even more beneficial to low-income older adults. But what else could come up under Medicare? If the date of solvency under Medicare Part A moves up, the date of doom, as they call it, that moves up, that could move action. Everybody's going to have a different definition of value-based care, so count on the Trump people doing that too. And then, of course, Medicare Advantage, as we talked about before. Next slide. The future of the Affordable Care Act. That's not going to be repealed either, because it has such enormous number of people involved in it. However, they can and may go after what they call these premium subsidies, which are used by 20 million people in this country. And if they were to abolish it, it would lead to a huge premium increase. This is where advocates, particularly those who have benefited from the Affordable Care Act, are going to have to get engaged, because this is an early action for next year, trying to address these premium subsidies. Next slide. This will be quick, because again, for Older Americans Act in 2025, it depends on what happens in 2024. If they finish it, we're on implementation. If not, we're back over, starting fresh with a new bill. And of course, who will be the new ACL administrator? But I want to take a second and let people see what ACL did under Trump 1. Next slide. There are a lot of movement, a lot of things that took place in the first Trump administration for ACL. The Commit to Connect campaign, addressing social isolation long before it became the topic it is today. They started developing the National Family Caregiving Strategy, it passed in 2017. We have our first data on adult maltreatment under the NAMRIS program for Adult Protective Services. They continued the work of the Elder Justice Coalition Coordinating Council. So there's a good track record there. And if we go to the next slide, I'll give you another place where I think they did the right thing in the area of elder abuse. And they said, look, let's also address elder abuse as the crime that it is. And they dedicated a lot of important law enforcement resources to fighting scams. Well, think how much more scams have proliferated since President Trump was president. The number of scams, the type of scams that are going on. This will be a priority issue for them, and it should be for the country. And we're going to work to have it included in what we hope is a reauthorization of the Elder Justice Act. Let's go 2 slides up. Let's skip the next one and go to the next one. Here we go. So this is what we get down to the final portion of the program, as they say. So I don't care, I mentioned Bush, I mentioned Clinton, I mentioned Obama and Trump. The one who has the best message wins. But messages and promises are different than actually getting policy done. And we should not forget that, because there's a process involved in policy making. And A message may get you to the point of getting it started, but this doesn't mean it's over. And let's go to the next slide. And, what was the key to this election? Everybody seems to know the economy and how people felt it impacted them was really front and center in people's minds. And therefore, for those of us who work on an aging agenda for the year ahead, it should be emphasized that older adults achieving and maintaining economic security should be front and center in our work, addressing cost of living from food to medicine to healthcare. But I think there's a great opportunity here for us to push the value of social care in America as a driver of lowering healthcare costs and improving health outcomes. And we know there's a lot of champions about social care that we could work on, and I think it's something we should put into the high part of our agenda going forward. Next slide. I think also we're going to see a lot more public-private partnerships in aging in this new administration, both to enhance resources, but also to promote innovation in aging and healthcare. And business can lead, and we're going to have a much more favorable environment to lead in this upcoming administration. And, we have challenges and we have opportunities that in 2025, that's 2025 in a nutshell. But I love what President Obama said last week. I want to read this to you. It is not about abandoning your convictions and folding when things get tough. It's about recognizing that in democracy, power comes from forging alliances and building coalitions. Purity tests are not a recipe for long-term success. So next slide, and the last slide. So what can we expect? Before the election, you have this question, you say, it depends. After the election, it's who knows. Maybe we have to bring back the art of reading tea leaves, but let's just stay tuned to one another and we'll keep you posted on what we know. And the very last slide is to wish you all happy holidays.
Thank you so much, Bob. We have time for maybe like one more question, and I want to pick a good one. But like I said before, we'll be able to, email all these questions and get them answered. I'm going to ask this one. With so many unknowns, how should local communities be preparing for the next 2 years, public-private partnerships?
Well, they should, first of all, encourage them to be established and to strengthen the ones that currently exist. And over the next 2 years, make sure you build your relationship right away, whether it's an incumbent in the House and Senate or a new person. Establish right away and let them know what you do, where they can help you, and promote what you do. Okay, one of the things that we don't do enough in our business is we do a lot of great work, a lot of great services, a lot of great research, but we don't disseminate properly. Okay, we need to get more people to see what it is that is done in the aging network space. So let's hope that we can have people do that, and I wish you the best in the 2 years ahead here. And thank you for all the nice comments I'm seeing fly across the chat here. It's been a pleasure to do this, trust me.
Awesome. Well,
Thanks,
I just
Bob.
want to, oh, Oren, what would you like to say?
Just wanted to say thanks, Bob. We always appreciate this, and this is always a great forum and always well attended. People really appreciate your insight.
Thank you very much, Oren, and thank the team there. Megan, Michelle, and Zoe for making it all work smooth. No flubs today. No, that was excellent.
We have 1 more minute, so don't jinx us. Yes, very special thank you to Zoe and Michelle for jumping in today. And I want to thank the chat and Q&A for joining us today and for engaging with us so much. And again, thank you so much, Bob and Orion, for your information. So in the chat, I posted the link for the webinar evaluation that we hope you will complete. Your feedback is important to us as it helps us to improve our programming, and your responses will be kept confidential and will not identify you in any way. And I'll go ahead and drop it again. So we hope you will join us for future events. This Friday, December 13th, we will be hosting Benjamin Rose's annual caregiving conference on the components of quality dementia care. We will have keynote speaker Dr. Gary Epstein-Lubow talk about the guide model for dementia caregiving, as well as several other industry experts and advocates who will share their experience. The conference will be held in person from 9 a.m. to 3:30 p.m. and will be broadcast simultaneously at 2 in-person locations in Cleveland and Columbus. You can register for the caregiving conference and all of our events on our website, www.benrose.org. There you can also find more information about all of Benjamin Rose's research, services, and programs. Thank you so much, and we hope you have a great rest of your day. Bye-bye.
Bye-bye, everybody.
Thanks.